Okay, special considerations for clients with special conditions. So now, what are the special considerations for a client with C. difficile? If you have a client with C. difficile in your NCLEX exam, make sure that you encourage hand hygiene with soap and water. It is mandatory. The next thing, you have to understand that alcohol-based hand sanitizers are not effective against C. difficile. So when you see C. difficile, it goes with soap and water. C. difficile goes with soap and water. C. difficile, it goes with soap and water. Now, what about RSV? If you see RSV, remember contact precautions. RSV goes with contact precautions. But they may also require droplet precautions if aerosols are generated. Okay. Now, use contact precautions for RSV unless aerosol generating procedures are performed. So, contact precautions, RSV. Meanwhile, C. difficile, soap and water to wash the hand. What about environmental controls? Proper cleaning of rooms and equipment. So these are done to prevent infection transfer from patients to healthcare workers and from healthcare workers to patients. Okay. Now, use dedicated equipment or disinfect after use in isolation rooms. And the NCLEX tip you need to know is that contact precautions require either dedicated or disinfected equipment. That's something you want to know. Okay. That's something you really, really want to pay attention to. Now, what about how to handle contaminated equipment? How to handle contaminated equipment? Equipment used in isolation must either be dedicated to the patient. So if you have a patient who is in isolation and you are practicing isolation precautions, the equipment must be dedicated to that patient, or if you are going to use the equipment on another patient, it must be thoroughly disinfected. Thorough disinfection is very, very important. Thorough disinfection is very, very important.